absolute pleasure to be here today. So thank you very much for the invitation, and Phil, thanks for the very kind introduction. Indeed, I have been working in mental health and NHS England and NHS Improvement for the last 4 years, so since just prior to the publication of the five-year forward view. And I have to say, I think now is probably the most exciting time for us. I think colleagues have been saying, you know, it must feel very busy and relentless, and it does. And that's because we've been working really, really hard together with a lot of you guys and a lot of our other stakeholders to bring together what we think is a really credible and exciting plan for the next 5 years for mental health that not only builds on where we are, appreciating lots of the very significant challenges that we have to overcome, but also looking to the future and really trying to build something that is future-proof for mental health. And we've done that with the help of many of you in this room who've contributed to the development of the long-term plan. So thank you. And I guess we're not starting from a blank page, and I absolutely appreciate everything Phil has said, and that challenge is real. And I'm up a lot at night, not only with my 2-year-old son, but also worrying about workforce, because I think our biggest challenge is to find the people who want to work in mental health to come and work with us. Having said that, there are some really exciting shreds of hope for us. So I think when we've advertised roles for people to come and work in our children and young people services in schools, we've had 50 applicants for every place. That's just an example. So there is a very high appetite amongst young people today to come and work with us in mental health. So I think we really need to capitalise on that. And I'm sure you will have heard this morning from Lisa Bayliss-Pratt about lots of the work that's going on there. So having said there's a lot of challenges, we are also doing really well, and we appreciate that, you know, this isn't me doing really well. This is lots of local services that many of you work in, doing some fantastic transformation work over the past 4 years, which have meant things are very different to where they were in 2015. So it goes without saying, all CCGs met the mental health investment standard in 1819, so we are seeing more investment year on year in mental health. And it now makes up, I think you said around 10% of spend, but it now makes up around 13.9% of local health spend in 2018-19, and that's increased year on year since the start of the 5-year forward view. IAPT, one of our flagship services that's now 10 years old, has now exceeded its 50% recovery rate target, reaching 52.1% in May 2019, so making a difference to a huge number of people who access those services every year. We very recently had the results of some data that we have done to look at how many children and young people were seen in NHS-funded services last year. And we were very relieved and happy that we saw more children than we had sort of targeted for 18-19. So 380,000 children and young people, which was 36% of the prevalence of children and young people with a mental health disorder, which is exceeding the 32% target that we had for last year. So lots more work to do, and I'm sure we will hear more from Emma about that, but there is definitely some progress with more people able to access services who need them. Eating disorders, we've got a new access and waiting time standard which will be introduced from 2021, and we're already seeing local areas stepping up and seeing young people who need access to those services urgently or as a routine much quicker. Community perinatal mental health services, I don't know if anyone in the room works in those services, but they have transformed, I think, since the start of the 5-year forward view. Now every part of the country has a community perinatal mental health service, where at the start of the 5-year forward view, that was not the case. We saw a very mixed picture across England. So really, really seeing some fantastic work there. For early intervention psychosis, many of you will know that was one of the first access and waiting time standards introduced for mental health, and we have exceeded the waiting time element of that target. Having said that, it's a two-pronged target, and we need to make sure that everyone who accesses those services has access to the NICE recommended treatment that is a key part of that ambition. And we are doing work with lots of services across the country, are working hard to make sure people are being offered the full range of services that they need to once they are in those services. And we now have every hospital with a consultant-led 24/7 A&E department having a specialist liaison mental health service, and with many more of those than did have before, having 24/7 access. So absolutely appreciate, long way to go and huge workforce challenge, but thank you, because we have made a big difference over the past few years to the services that people who need access to them can access. So thank you. And as I said, I'm going to keep plugging it. We have published the long-term plan in January 2019 with enormous thanks to the phenomenal mental health sector contributions that we had. We had 150 individual contributions from people like you across the country representing the views of more than 150,000 individuals. So that is phenomenal. And what we found, and I was astounded when we reviewed those, was a huge amount of consistency in what people wanted to see in the next long-term plan, so building on what we'd seen in the 5-year forward view. So I feel relatively confident when I set out next to you what the priorities are for us over the next 5 years, that those are what people, they are genuinely what came back in the consultation and what people told us they wanted to see happening. And the other really exciting thing, and I appreciate it's a big challenge, is that for the first time, the long-term plan announced that mental health funding would be ring-fenced. And what that means is that we are able to hold local systems to account and make sure that they are spending the funding that's been set out by the government for mental health on mental health, which I think is, you know, a definite step forward from where we were even when I started working in mental health just a few years ago. So I think we've come a long way, and it's a really exciting plan. So the key deliverables, and what everyone told us, and probably the most common response that we had to our open consultation, was that we need to do something about community mental health teams. And they weren't a feature of the original 5-year forward view for mental health, and I think many people felt that they had therefore suffered as a result as people moved into working in more specialised services. And we've heard that we need to see a revolution in the kinds of services that are offered to people with severe mental illnesses in the community. So we are very excited that more than 1 billion of the 3 billion real terms, or 2.3 billion, 3 billion cash terms, or 2.3 billion real terms funding that we're seeing, more than 1 billion of that is for people with severe mental illness, and a revolution that we need to see in community mental health teams. So I'm very excited that we are going to be shortly announcing some test sites who are going to go further and faster with us on developing those in the next couple of weeks. I hoped that today I would be able to say we announced them last week, but unfortunately that's not the case. We will be shortly announcing them. I think people who are working in those services know who they are. They're already starting to work with us. They're piloting waiting times in community mental health, and they're also looking at developing services for people who need access to specialist services like eating disorders, or for people with services for people with a personality disorder. So that's really, really exciting piece of work. Similarly, I'm not going to talk lots about this because I'm sure Emma will a little bit more, but children and young people's mental health also came back as one of the key priorities for us. It has been a priority for the past 5 years as well nationally, but it needs to continue to be so. We need to do a huge amount more work for our children and young people, and we need to see more people. We are introducing new services via schools, via these mental health support teams that I've alluded to, and we're also continuing to work on driving forward improvements for people with perinatal mental health difficulties, including for fathers, which is really, really important. So crisis care, I think Phil's talked a lot about what our priorities there are, so I won't go into that in any more detail, but just to highlight that an interesting and important feature of that is that we are testing some standards for urgent and emergency mental health care. So as you know, the NHS is testing its clinical standards more broadly, so looking at whether, for example, the 4-hour target in A&E is a good idea, or whether there might be something that is better, that gives better clinical outcomes for patients and better experience. And alongside that broader testing, there are some testing going on for mental health, including for urgent emergency mental health care, and we're working with 11 mental health trusts across the country to test that, which is fantastic. Another really exciting piece of work, which again many of you may be involved in, is the work to roll out provider collaboratives. So this is where historically NHS England has centrally or nationally commissioned specialised services for people, which has created a bit of a barrier between specialised mental health services and services that are commissioned by local commissioners. What we're looking to do is to break down that barrier and make sure that decisions are taken more locally, and we've been running a pilot programme since 2017, which has been reasonably successful. We've seen improvements in 550 patients being able to be seen closer to home, and money freed up for investment that would have otherwise been spent on care for people out of area, which is not beneficial. So we're working on mainstreaming this approach, and we very much hope that this will support mental health trusts to really lead the charge in those emerging ICSs. It's building some of that commissioning capability within provider organisations as well as CCGs and ICSs, as Phil has talked about. So I think we've also talked a little bit already this afternoon about co-production and the guidance that actually NHS England commissioned, that guidance with the pictures of the hands on it that Phil put up on the screen. It's a fantastic local resource to help people think about best practice and what the evidence base is for co-production. And we've similarly published some guidance around health inequalities and how we can build on them. And we are committed to meeting the recommendations of the Mental Health Act in terms of introducing a patient and carer race equality framework over the next 5 years, because we know there's a huge amount of work that needs to be done locally around health inequalities, and we're keen to support it. So this week, I think Phil alluded to the fact there's lots of hard work going on locally to develop local plans that reflect the national plan, or that are even more ambitious than the national plan for local populations. And over the next couple of weeks, me and my team, what we're going to be doing is taking a look at those plans and working out what we need to do to help support final development before there is publication and finalisation. So there's just a summary for you there. That's mainly just to remind me what I need to do next week, as well as to share with you, I guess, transparently, how are we going to make this national plan a local reality. It's going to be difficult, but we know that the hard work is going on, not where we are, but where you are. So thank you very much. That's it from me.